So the purpose of this program is, it's like a pilot project. So we thought that I become a corporate member of the association and under the guidance of Vishwanath sir and image sir. We thought that every month we call two senior consultants from different specialties. So this session I am physician and diabetologist. Another is Dr. Pawan, is senior intervention cardiologist, working in Manipal. And the doctors who preferably nearby hospital to the Dr. PFC, and also Dr. Kiran who is working here. All of you can give a feedback to Vishwanath sir, what can be improved, what can be done. So any doctor nearby hospital, any specialties who can express the interest in us, we can analyze and improve it. So coming to the program, I will briefly explain the program structure, what we are going to do today. First is my talk. It's some 10 minutes I'll speak about preventive health and we'll have some interaction. Then I'll speak about essential vaccines for the elderly. Because people always think that vaccines are only for children. So there are many good vaccines, good for elderly also. So after my talk is over, Dr. Pawan, the senior cardiologist, he will speak about how to keep the heart healthy. Because nowadays we are seeing all young people are dying out, sudden cardiac deaths and so many cardiac interventions and other things. After that he will give us live demonstration of how to do CPR. Because how to do CPR, even though we know there are many mistakes, so we can hear from the experienced cardiologist, and he also share many experiences how we save the people in emergency. I will give a recent example in Shobha Forestry. A 50-year-old gentleman having playing a badminton suddenly collapsed. The person who was playing with him is a radiologist. But many times, not so that all the specialties know the CPR properly. Many times other specialties were not clinically inclined or don't know properly. But luckily, he started a CPR till the Shobha Forest, till they reached the Manipal emergency. They continued CPR almost for a 20 to 20 minutes. Once they entered emergency, the emergency people took over the case, and immediately Dr. Pawan was called and they did a emergency angioplasty. After angioplasty, he went into hypertension, and on the third day, he got the bleeding of the rectum and other things, because after angioplasty they give a lot of blood thinners that cause bleeding. Then the ICU stay continued, gastroenterologist is seen. After 2 weeks of hospital stay and all, he successfully recovered. In here, the first thank has to go to the person who did a CPR. The first, I just told this story to know the importance of CPR. So more about it will be explained by Dr. Pawan. So I will begin my short talk on preventive health. So good health is a crown on a well person's head that only ill person can see. Others won't understand. So one of my patients asked me, sir, anyway, whatever you do, whether you do annual health checkup or not, whether you do walking, whether you do diet or not, people will get diseases. So any day we are going to die. Why to follow all these things? So I was little silent for some time. I told, we do car servicing periodically as per the advice of the car dealer. Even then, cars sometimes break down. Car go for a puncture, some engine breakdown in spite of periodic service. Suppose if you don't do any servicing, then the chance of breakdown is 100%. So that's why there is some health awareness, preventive health checkups, preventive health tips, everyone must know. So, a well person doesn't understand the importance of the good health. Suppose a paralyzed person having a stroke in the hospital, He is ready to do anything to regain his strength. That's the intensity. Only the diseased person understands the importance of health. But because the consciousness is not there, because most of us live in a hurry. So we don't live like a Buddha. The living like a Buddha matlab, living mindfully, cautiously is a way of living. But we won't do that because we are in a hurry. Only when suddenly something happens, we'll remember. If somebody has heart attack, our neighbors or our friends, realize, I have to check myself. Don't believe this. When Puneet Rajkumar had this cardiac arrest in this one, hospitals, all clinics, like everyone coming, young people, 21 years, sir, please do ECG for me, do TMT for me. And many people happen like this, even though it's more with the cardiologist. So only something happens, people start realizing. Otherwise, the realization won't be there. So coming to the next, I'll ask questions, anybody can answer. What do you think the two most important things to keep ourselves healthy? Anybody can answer.
Okay.
Diet and exercise.
So one time. So diet and exercise. Okay, next, anything else?
Peace of
To be
mind.
active.
Peace of mind.
To be active.
Oh, to be active.
Peace of mind.
Smile.
Peace of mind.
Timely sleep.
Smile.
Sleep.
Timely sleeping.
Timely sleeping.
Regular checkups. Regular checkups.
Regular preventive checkups. Anything else?
Smile in the face. Smile in the face.
Smile in the face.
Not seriously, the problem is serious.
So let it go. Let's not go too deep into the problems. Parents also prepare. So all of these are correct. All of these are correct. So one thing is seriously missed here. There is a book called Ikigai. In this book, there is a deep research is made into the elderly people who lived more than 100 years. More than 100 years healthily. One person from Japan, one from China, one from South Korea, one from Italy, different countries. All these summaries, all were doing what people told. Most of are doing moderate eating, moderate exercise. None of them are doing like I went gyms and all, moderate exercise, moderate eating, and all were sleeping well. But two things most people doesn't understand and then come to know on this. Most of them people are spending 3 to 4 hours in a day in a things they hardly love. Like you really love to play cards 3-4 hours, you play. That sense of being is too much important. And if you really love to watch movie, you watch one movie every day. Because that gives you long-lasting satisfaction. You want to do gardening, or you want to take your grandchildren to the play, whatever you really like, because that's a different from person to person. How we grow in childhood, no? There is something which you really like to do it, but you don't have time to do it. Identify that and start doing the things, our longevity increases. This is one of the research findings. Because most of us didn't do. I want to do that, but I don't have time. Maybe family circumstances doesn't allow it. So, irrespective of whatever the circumstances, if you really want to do something, you spend 3 to 4 hours in that. That is most important. Second thing is, one more thing I realized is, most of all these people have a sense of purpose. Sense of purpose, most of the people think that after retirement, they think that our life is over. So whatever we are supposed to be done, we have done it. Now nothing more left for us. So this feeling should not come to us at all. So whatever the age, don't have the feeling of retirement. Try to stay active. To stay active, you must have some purpose. Purpose means what? Purpose could be anything. Oh, I want to do this thing next year. I want to see my grandchild marriage after 10 years. Something. I want to live for my kids. I want to live for grandkids. I want to travel the whole world. I want to see this. I want to do this. If you have some purpose, your genetic flow automatically increases your age. So you have a sense of purpose, and if you spend 3 hours in a thing, you really love it, then irrespective of your here and there abnormal diet and exercise also, people can live longer. So these are the most important things people miss it. So along with that, traditionally one more thing for a good health is a fasting. Fasting, see, you take any religion, whether it's Islam, Hinduism, we do Sankashti, Shivratri fasting, Christians will do Easter, Muslims will do Ramzan. Any religion, there is a fasting. So it has almost, whenever this Vedic period started 10,000 years ago, from that time the fasting is there. So periodic fasting is like a detoxification. In 2017, the Nobel Prize was awarded via autophagy. A person invented a concept of autophagy. A Japanese scientist was given a Nobel Prize. In simple terms, the concept is autophagy is nothing but removing our toxins from the body. So how it happens? If you keep on doing a regular fasting, 50 to 16 hours, automatically the toxins get removed. Suppose if our machine is continuously running, we had a breakfast, we lunch, dinner, then watching TV, some snacks, some fruit, till the night 11 o'clock if you are sleeping, we continuously eating. So there is a rest for the body. So automatically body doesn't heal. So fasting is one of the important things everyone must do, except people are on some diabetic medication. They have to be careful when doing fasting. Rest or whichever is the capacity can do fasting. You know why that we call it the break fast? The term break fast came because breaking the fast. Okay, nowadays what happened? In the 15th, 16th century, all over the world, there was no electricity. So people used to have 6 o'clock, 6:30 dinner, and usually there is no cooking in the night. And next day, when the sunlight comes, they arrange everything and do breakfast. 6 o'clock to next day 9 o'clock, it's almost 15-16 hours. That's why they call it as breaking the fast, called as breakfast. But now what happens? People are watching normal eating time in many is 9 o'clock, 10 o'clock. And if you're watching a series or movie, we have something in the while watching TV also. In the morning, everyone is in a hurry. They want to go somewhere, office, something, they are early breakfast. So late dinner, early breakfast. Olden days, early dinner, late breakfast. My grandfather used to have brunch most of the days at 11 o'clock. Then he used to go to work. This was the concept in many villages. So all these are lifestyle. Everyone think that why we are following the same diet like our forefathers. Why they were healthy, why they are ill. You know, you can observe one thing. We are living in the most prosperous times in the history. Okay, none of our generation has. People only 50-60 years ago, I have seen World War I, World War II, the whole world got affected, and people are even for the freedom struggle, that's war. Now there is no major war. We don't consider this India-Pakistan as a war. It doesn't affect us in practically. So no wars. We are in a heights of technology. We having an AI, mobile, so and so, and we have n number of hospitals. One of the Bengaluru has almost in next 3-4 years. Another 10 corporate hospitals coming up here. And we have so many dietitians, so many doctors, still people are unhealthy. Why so? Because you change a lot in 50 years that our bodies cannot adjust. Because our genetic flow changes 10% in 5,000 years. So Homo sapiens, human beings have a history of 2 lakh years. They started from the nomadic life, living in a forest. We are eating whatever the vegetables, fruits, meat, whatever it is, from that day to second life, Vedic life, agriculture life. In this side, 5,000 years to change, but in 50 years we have changed so much. You see, last 10-15 years, amount of our screen exposure to the mobiles and other things is too much. Not only for us, the kids, imagine that. So we never used to see that so much of YouTube, TVs, like what our kids are doing. All this have an implication on the health, directly or indirectly. So this is something about a preventive health. And with this I will start a brief session on the adult vaccine. After that I will take few questions. Then Dr. Pawan will start the thing. Then at the end we have any questions which we can take again. So why vaccines matter after the age of 50? So normally there are n number of vaccines people give for a kid, pediatrician, kids. They go to the pediatrician without fail and get the vaccination done. But adults neglect vaccination, except something like a COVID outbreak. they don't bother to take vaccines. That's also one of the things, people lack motivation in themselves.
And lack of knowledge of.
Lack of knowledge also. So one is, after 50, usually our immune system slightly weakens. So if you have a diabetes and other comorbidities, immune system further weakens. So the difference between immune system, I tell one thing. Suppose somebody is having uncontrolled diabetes. He gets a fever and somebody is healthy, very healthy, and he gets a fever. There is a difference. Because the person who has uncontrolled diabetes they already have low immune system. Not only uncontrolled diabetes, want to have a poor diet, lack of sleep, too much of stress, all this will affect your immune system. When you're having every other thing, automatically weakens. Even if you are healthy, if you're doing everything normally, no diseases also, after 50, immune system slightly weakens. But if you are not at all in having so many other things, immune system further weakens. So that's one of the reasons we should be careful about preventive things. Higher risk of severe infections and complications. And if you take a vaccines, hospitalization can be prevented. You have seen what happened after the COVID vaccine. COVID second wave, many people have died. After the vaccination, it may not prevent COVID. Don't be the illusion that vaccines will prevent disease. Vaccines will prevent the disease complications. Suppose you get a COVID vaccine, you got a COVID, you recovered out of home care or some infections, but it avoids you going to ICUs in most cases. You won't get put on a ventilator, you won't spend time in inpatients as a, so these avoid complications. Same thing in the other vaccines also. And it protects individual and families. How it protect families? Because the most important gift we can give to our family is keeping ourselves healthy. If you are unhealthy and frequently hospitalized, frequently going to doctors, spending so much of money on healthcare, who will suffer? Our families will suffer. The first vaccine everyone must take is flu vaccine. So in Europe and America, it is quite common. The flus are very severe. They will take annually. But in India also, at least people above 50 years who have a diabetes or some lung issues, or somebody is having recurrent throat infections, recurrent lung infections, bronchitis, all those people, before the start of monsoon, preferably, you can take any time, because usually the new strain will come after June. Take this flu vaccine every year. So this is, remember, the flu vaccine has to be taken every year. Some vaccine have to be taken once in 3-4 years. This every year, the approximate cost of this is around 2,000 to 2,500. Every year the price varies, but the approximate cost is this. So if you think that you avoid some flu symptoms and other complications, I suggest better take flu vaccine every year. Next is pneumococcal vaccine. So in a common term, pneumonia vaccine. So this is, the medical indication is, anybody above 65 years who have a diabetes or any bronchitis, who have recurrent lung infection, must take this pneumonia vaccine. So this pneumonia vaccine comes in 2 doses. The first dose is PCV13. After that you have to take it, one more vaccine called PPSV23 after 1 year. If you do these 2 vaccinations, it will protect you from severe pneumonia for the next 5 years. So this vaccine is not indicated yearly, at least once in 3 years or once in 5 years. Because many people, old people, when they are hospitalized, they are hospitalized for the pneumonias, especially diabetic. Any diabetic, remember 2 things. What are the 2 common infections in diabetics? Matlab, one is lung infection, other is urine infections. So this will prevent elderly people from the pneumonia. This is a 2 dose. Even somebody take only 1 dose also, it has some protection. And this is again herpes zoster vaccine. So everyone knows about chicken pox. So many of us caught chicken pox in the child. What happens? This virus remains within our body nerves sometime throughout the life. So once after 50, 60 years, whenever the body immunity goes low because of diabetes, some diseases, or some cancers, or some stress and all, this virus become activated again, and that causes herpes zoster. This is a very, very painful condition. For example, chicken pox, like the lesions comes all over the body. But in herpes zoster, it affects only particular nerve. Suppose this nerve affected only comes here, but it is extremely painful. And people suffer from pain for almost 6 months, 1 year. Especially for diabetic, it is still more than. Many times we give long-term medications. But this vaccine is little costly because one injection costs around 10,000 rupees. But preferably, especially advice you have think that low immunity of any of the diseases or uncontrolled diabetes, still it is worth taking 2 doses of it. And this Tdap vaccine. So everyone is aware of the TT vaccine. So whenever we get injured, we go and take a TT vaccine. Many times patients only come and ask, doctor, buy TT vaccine. Here what you can do, every adults, they need a booster dose of TT vaccine, Tdap vaccine every 10 years. So instead of taking TT vaccine whenever required, every 10 years, you can take 1 dose of Tdap. That will protect against 3 diseases, tetanus, diphtheria and pertussis. It's also one of the good recommended vaccine. It's simple, it doesn't cost much. Very simple vaccine. You can take booster dose every 10 years. So again, COVID-19 vaccine, this is only as per the outbreak, government guidelines. Whenever the government guideline says this is the time to take a vaccine, you can take a vaccine.
But where will get vaccine? Sounds like it. Where will get vaccine?
See, previously mentioned all the vaccines are available in the pharmacy. Only case herpes zoster and all, you have to see some pharmacies. Otherwise, flu vaccine, pneumonia vaccine and all are frequently available. Even any clinic, small pharmacy also you can get it. Okay. COVID vaccine as this government guidelines, and the government needed the public health, they will announce it. And this is hepatitis B vaccine. So hepatitis B is one of the common cause of liver cancers. People especially working in hospitals, doctors, paramedicals, or people who are in a public life, who are frequent, they are going with the crowds and other things, you can take this is a 3-dose vaccine, 0 after 1 month again and after 6 months again. Again, this is not a compulsory vaccine for everyone. So depending on the risk factor, some people get this vaccine for dialysis. People having a CKD and dialysis, they must receive the vaccine because nephrologists advise this vaccine. Others, depending on the priority and lifestyle, can get this vaccine, but not a compulsory vaccine. And every 3 to 5 years, pneumococcal vaccine. Shingle vaccine, if you take 2 doses, that's enough. It will give for immunity for many years. Tdap vaccine every 10 years. COVID vaccine, the government announces take booster doses. Hepatitis B, 3 dose, schedule 0, 1 and 6. Some of the very, very important vaccines. And there are other vaccines which is not much important, like somebody get a frequent every year getting a typhoid fevers. They can get a typhoid vaccine. And some people are living in a little unhygienic area, they are not getting a good water supply, infected waters. They can get a hepatitis A vaccine. But they're all depending on the circumstances and depending on the area. These are the common things most of us need. So this is in short about my talk. If you have any doubts, you can ask me. 3-4 questions. After that, Dr. Pawan will start. Remaining questions we will take later.
Sir, if I opt for taking all the vaccines, what side effects you will have?
So nothing much. You need not take all the vaccine at once. In a period of 15 days, you can take flu vaccine and other thing. No harm. Not the common side effects of any vaccine is people will get a feverishness. And when not to take a vaccine, suppose you have already have a flu, you already have a throat infection and fever, should not take vaccine at that time. Because to produce antibodies, the response will be lesser. So when you are normal, suppose many people ask this, doctor, I am frequently getting infection, please give me vaccination. That's not the right time. You recover from the infection, then you take a vaccine. The side effects are very, very minimal, nothing major side effects.
I am just 17 years old. I don't have any sugar and all. It is necessary to take a vaccine.
Yes, because as even without anything, our body immunity slightly weakens after this age. At this age, better to take a vaccine.
So, you are talking about CPR. Can we have some sort of a training program?
The Dr. Pawan will do it now. Next session is about the topic.
So if we can have that training program here, I think
Yeah.
Sir is the best man for that. Especially our security. And some of building wise, let us say some 20 people, so that building can have, it would be a fantastic.
Yeah, what is there is the image that told that we are already arranging for security and all every 3 months once. So we thought that it is personally only for the residents. So we will do that. We will do frequently, periodically if required. If there is a demand, we will do that.
We had a team earlier,
Yeah.
when there was a different vendor,
Okay.
he had a dedicated ERT team.
Okay.
So they were trained in all this.
Okay. We will discuss it.
Is all these vaccines available in Manipur?
Yes, yes, all are available. Something could be that it's out of stock, but you can get it in one day. Within 24 hours, you can get it.
Hello. It is very costly. It is not for common people. Why can't you do for the rest?
So that is like pharma industry is owned by companies. Only governments can subsidize these kind of vaccines. To be real, government takes so much of tax from us. They should subsidize this vaccine for the elderly at least. So hospital, yeah.
So this shingles is subsidized, not?
Not subsidized. Because this whole pharma is controlled by companies. They work for their profit. It's only the government who can control the pricing and their monopoly.
But it is not useful for the research.
Definitely. But really doctors and hospitals don't have control over it.
Doctor, I have a question.
Covaxin, there was a rumor that we had a very side effect. It weakened the heart of the people.
So actually among all the COVID vaccines, among all the COVID vaccine, Covaxin is the safest. You know why? Covaxin was the only killed vaccine among the COVID vaccines. Because killed vaccine is already taken in the childhood. Our body used to it. Covishield was a hybrid vaccine. Pfizer vaccine was the first time experimented in the world. So I strongly believe people who have taken Covishield and Pfizer vaccine has more heart attacks. Even though government deny it, they have heart attack. Even in my opinion, based on my research, even Punit Rajkumar also died because of the vaccination side effects. He might be having some family history. Many young people have died of vaccination side effects. In that, Covishield and Pfizer vaccine is more common. One of my friends, who himself is a doctor, who worked in Dubai as a pathologist. What Dubai government did is, first, whenever the China vaccine came, even though it's not effective, they given 2 doses for all the doctors. After a few months, US government has announced, so we are releasing a Pfizer vaccine. They bought again the Pfizer vaccine. They again given the Pfizer vaccine to many doctors. And he himself had got COVID once. When he came to Bangalore, he just got a regular checkups. Then he got a CT coronary angiogram out of interest. He got a 75% block. And he has no comorbidities, no diabetes and all. Then I was surprised. I spoke to him what could be the reason. Only cause, there could be other reasons also. Only cause I could find out is he has overtaken the COVID vaccines. And some people have taken unnecessary boost dose of COVID vaccines. All this can also. And second thing is COVID vaccine alone cannot cause heart disease. Suppose we already have some risk. Over that, if the vaccine can cause, it can cause blockages. Yes.
Sir, you suggested vaccines for certain age limits, after 50, after 60, like that. Now, most of us are already above 75, fit and active. Now, what should we do?
Sorry, above 50, matlab, all the ages are included. All this vaccine.
No. Right, it is serious question. All are above 75. Okay. Do we still need anti-tetanus or like that and all?
It is needed.
Because your age structures was
Yes, yes.
different.
It is
above
needed.
51 vaccine, above 50 under, above like that.
So the generalized thing, above 50, anyone can take it.
Doctor, I have a question. Of late, we have seen that autoimmune disorder is common and chronic thing. Those who are already suffering and on medication for autoimmune, can they go ahead and take these vaccines?
Yes, because autoimmune disorders have weakened the immunity more. That's one of the conditions where the immunity is already low. For example, you heard of arthritis, rheumatoid arthritis. Everyone knows that rheumatoid arthritis is a joint problem, but it's a systemic problem. People having rheumatoid arthritis have immunity, low immunity, decreased compared to other population.
Okay, but that will not aggravate their current situation
No.
by having these
Because
vaccines.
vaccines are meant to prevent, and it is good for a weakened immunity low individuals. Only thing is you should not take a vaccines when you having that particular infections are there already in you, that time you should avoid vaccine.
No, infection means I didn't understand.
For example, you have already herpes zoster.
Okay.
That
fine,
time you should
fine.
not go and take
But autoimmunity is still there.
Autoimmunity,
In spite of that,
you can take it.
okay.
Because autoimmune also there is a flare-ups.
Yeah, I
They have
think
flare-ups
ESR
also,
rate will go
they get some
up.
fever, joint pains.
Yeah.
In such time they should avoid it. When they are little stabilized, normal, they can go and take it.
But still they will be on medication.
And still there, consult a physician and take a advice depending on the disease condition. Take a prescription and take it. Not like commonly we cannot take as OTC.
Yeah, okay, thank you.
One of my friend is around 68 years. He is a chronic CKD patient and almost CKD 5, 6, 7. Now, can he take all these vaccines?
He can take vaccine, all these vaccines. can be
Is
taken.
it not because general feeling is CKD patients should not take antibiotics
CKD patients are
or
given a
things like
certificate
that.
vaccine. No.
So-
CKD patients also have a low immunity status. They come under the category of low immune status. They can take a
CKD
vaccine.
means chronic.
Kidney disease. People, in a real term, people already have dialysis, creatinine is already 3, 4, 2 point, long time.
Yeah.
They call CKDs.
Can they still take
They
it?
can still take.
No side effects.
No side effects.
My name is Manjuna.
So
I'm thinking a little further before. Instead of just recommending all the vaccines, can we think of, there was some time back, there was somebody who came and did a genetic analysis here.
Okay.
If we can arrange something like all of us go through kind of a DNA testing, I'm a geneticist by profession too. Will that be a thought process where we can identify where are you susceptible to, and then we can take those vaccines? Could I mean, I'm just thinking, in being a part of the PFC, I saw that it's quite affordable. 15,000, 16,000 rupees, you can do a total genetic analysis. At least if you can find out what are the things that we are susceptible to certain diseases, then that's one.
Genetic identification definitely gives some clue
Okay.
what kind of diseases you may get in,
Right.
what kind of disease, cancers, other things you can
Yeah.
get. But if you are having a poor lifestyle, your genetics also can't help it.
So,
There is, and if with a good lifestyle, there is a epigenetics. Genetics just also can be modified.
I totally agree with you.
Okay.
In fact, the same
But
thing
if
with
it is a cost effective really, genetic checkup and all, they can be done.
At least, yeah, what I'm thinking about is as a community, if we can have some kind of a program where instead of doing 1 or 2 DNA analysis, if we can do it for 100 people, I'm sure the cost is going to come down. There are lots of people who are doing the analysis. I'm just thinking aloud.
Yeah,
That's
you can
that's
think
one.
you can think
Second thing
about
is,
it.
I think among all, DEAP is something which we all need. Keep falling,
Yes,
we
yes,
have
yes.
injuries.
So I listed only the
If we can
essential
have a
ones.
community kind of a vaccination program organized by the association, it will be excellent. Thank you.
So we'll stop at this stage. If any questions, yeah. Please.
You have mentioned so many vaccines. Now, is it necessary for a normal, healthy human being to take all the vaccines? And if yes, at what intervals?
So I told already the flu vaccine every year, the pneumonia vaccine once in 5 years, at least one time.
Not necessarily take every year.
No, some flu vaccine is necessary every year. Other vaccines like Tdap every 10 years. Like every vaccine has this another separate. Depending on the condition, you must discuss with your physicians, and if you take prescription, you can take these vaccines. So now I introduce Dr. Pawan Kumar Rasalkar. He is a senior intervention cardiologist. He is graduated from the prestigious AIIMS, Delhi, and is now, he worked earlier in 40s, now working in the Manipal Kanakpura Road. So I am also working in Manipal Kanakpura Road. They both available full time there. So he is having a social concern, passionate about giving a CPR demonstrations, and we both had a CPR demo in the Art of Living a month ago. And we are also doing this kind of things when there is a need or call for us. And we will start this initial talk on heart health, then we will give a demonstration about CPR.